Honorable Reginald Ostry, Senior Minister and Minister for Housing and Urban Development and Acting Prime Minister of the Commonwealth of Dominica. Honorable Irving McIntyre, Minister for Health, Wellness and New Health Investment for the Commonwealth of Dominica. Honorable members of the Cabinet, Dr. Carissa Etienne, Director of the Pan American Health Organization. Dr. Jarbas Barbosa, Assistant Director of the Pan American Health Organization. Dr. Merle Lewis, Chief of Staff of the Pan American Health Organization. Other members of the PAHO team, Mr. Marlon Marie, UN Country Coordination Officer. Members of staff of the Ministry of Health, Wellness and New Investment. Other distinguished guests, members of the media, ladies and gentlemen, good morning. And welcome to the 20th celebration of Vaccination Week in the Americas, which we are celebrating from the 23rd of April to the 30th of April, along with the 11th World Immunization Week. We are live today after 2 years of virtual launches, and very happy to be transmitting this to the Americas from the beautiful island of Dominica. Under the slogan, "Are you fully vaccinated? Get all your shots." This year's Vaccination Week of the Americas campaign sets itself to close the immunization gaps wherever they may be. The goal is to reach those who have not yet reached the full benefits of routine immunization and/or the COVID-19 vaccination, and speed up activities to get immunization programs back on track and achieve the goal of vaccinating 70% of populations in all countries. Today, we are here to launch this year's campaign, hoping to reach more than 130 million people around our region and to celebrate and recognize the impact and importance of immunization as a public good to protect us and keep us healthy and thriving. We would also like to highlight that this would not have been possible without the unwavering support of our partners and allies who have supported Vaccination Week since its beginning. The vaccination program is an excellent example of disease prevention throughout the life course, from our infants' routine immunization programs, to HPV vaccines in adolescents, to the flu vaccines in adulthood. And I don't need to say, all of you know about the importance of the COVID-19 vaccination programs. This is why initiatives such should not just be the responsibility of the Ministry of Health, but as you all experienced during the COVID-19 vaccination program, this is an all of government and an all of society responsibility. Hence why today we have also a number of members of the Cabinet of the Commonwealth of Dominica, because this is an all of government and all of society program. To start off today's launch, I now give the floor to the Honorable Dr. Irving McIntyre, Minister of Health, Wellness and New Health Investment of the Commonwealth of Dominica, for his opening remarks. Minister, I take the floor.
Thank you very much. Honorable Reginald Ostry, Senior Minister and Minister for Housing and Urban Development and Acting Prime Minister, Honorable Members of Cabinet, Honorable Dennis Charles, Minister for Tourism, Honorable Kozia Frederick, Minister for the Environment, and Honorable Ken Edwards, Parliamentary Secretary in the Ministry of Health, Wellness and New Health Investments. Dr. Carissa F. Etienne, Director of the Pan American Health Organization and Regional Director of the World Health Organization. Dr. Jarbas Barbosa, Assistant Director, Pan American Health Organization. Dr. Merle Lewis, Chief of Staff, Pan American Health Organization. Dr. Godfrey Schweb, Head of Country and Sub-Regional Coordination, other members of the PAHO team, Mr. Marlon Murray, UN Country Coordinator, Officer, member of the staff of the Ministry of Health, Wellness, and New Health Investment, other distinguished guests, members of the media, ladies and gentlemen, pleasant good morning to everyone gathered here today. On behalf of the Ministry of Health, Wellness, and New Health Investment, and by extension, the people of Dominica, it is my pleasure to extend a warm welcome to all of you who have joined in person and virtually this regional launch of the Vaccination Week in the Americas. We're indeed pleased that the Commonwealth of Dominica was the country selected to host the regional launch, particularly since the Vaccination Week in the Americas this year is a very special one. It is special because together as a region, we are able to have this face-to-face launching after 2 years, in spite of the many challenges faced during the COVID-19 pandemic. This year, Vaccination Week in the America reaches its 20th year celebration under the call to action, "Are you fully vaccinated? Get all your shots." It is well known that vaccines are among the greatest advances in modern medicine. They have contributed significantly to reduce the child mortality rates while saving millions of other lives. Vaccination is the most important action we can take to protect ourselves, our children, and our family members against preventable diseases. Research has shown that vaccines prevent approximately 3 million deaths worldwide every year. As a medical doctor, I'm well aware of the devastating effects of vaccine-preventable diseases on children. As a government, we are also aware that economic and social conditions under which one lives will help determine one's health, and therefore, we have a public health commitment to our people to protect them from vaccine-preventable diseases. Dominica, through our primary health care system, boast of a successful maternal and child health program. Immunization is provided under the expanded program of immunization, that's known as the EPI, one of the flagships of the health programs in Dominica. The EPI program offers vaccines free of charge at the primary healthcare level throughout the life course against diseases to include diphtheria, pertussis, tetanus, measles, mumps, rubella, tuberculosis, poliomyelitis, and hepatitis. In 2019, we also saw the successful introduction of the Hpv vaccine for adolescents, which had one of the highest introductory coverage in the region, reaching approximately 92% of adolescents. More recently, we introduced the COVID-19 vaccines with a current coverage of over 43% of the total population being fully vaccinated. As a small island developing state, we would have grappled with the inequitable distribution of the COVID-19 vaccines, if not for this foresight of PAHO through the COVAX facility, ensuring that Dominica got its fair share. We also witnessed the generosity of some of the more developed countries who have easier access to the vaccines, and Dominica was on the receiving end of this generosity, for which we are grateful. In order to make the best use of these kinds of donations and to accelerate our vaccination uptake, we needed to implement unconventional and non-traditional concepts in these unprecedented times. We commissioned the National Vaccination Unit to strengthen the program, and within that unit, we activated the mobile vaccination team, which brought vaccines to every nook and cranny of the country, resulting in the inoculation of many who, for one reason or another, could not have accessed more traditional sites. This mobile vaccination team remains active and functional up till today. It is also noteworthy that we recently launched our digital vaccination certificate, providing a more secure and accessible alternative to the paper-based card, all in an effort to encourage inoculation. Throughout the last decade, Dominica has maintained vaccination coverage of over 95% in most vaccines. However, the ongoing COVID-19 pandemic has severely impacted our EPI program. Figures suggest that there was a reduction in the vaccination coverage and a decline in the total number of vaccines administered. This is due both to the COVID-19 related burden on the healthcare system and the decreased demand for vaccination resulting from social distancing requirements. We are cognizant that disruption of immunization services, even for brief periods, will result in increased number of susceptible individuals and raise the likelihood of outbreak-prone vaccine-preventable diseases. In other words, if the people stop taking the vaccines, it's possible for infections, diseases to quickly spread again. The government of Dominica, through the Ministry of Health, Wellness and New Health Investment, remains committed to avoiding the occurrence. To this effect, we have been implementing several strategies to support the Pan American Health Organization's efforts in aiding us in preventing these vaccine-preventable diseases. The introduction of the electronic immunization registry, which will allow us to have updated information for decision-making, as well as facilitate monitoring coverage and defaulters. The strengthening of our community outreach activities, including the establishment of vaccine animators. These animators visit homes to promote vaccines and to address public concerns. The continuation of our communication campaign using traditional and non-traditional means. The strengthening of the cold chain network included in all our district clinics. And lastly, very importantly, the retraining and continuous updating of our healthcare workers and other support personnel. Ladies and gentlemen, the COVID-19 pandemic is a devastating reminder of the chaos caused by diseases we cannot prevent. Vaccines now offer us a way to tackle the pandemic. We are not settling for a return to normal. Instead, we want to build back better and improve on missed opportunities. It is critical that we ensure that vaccination becomes part of our everyday program and get to a point at which every person is updated on their vaccination schedule. We can do better, we must do better, and so we will not stop until this becomes a reality. Dominica will take advantage of Vaccination Week in the Americas to scale up our country's efforts. I am sure most of you must have heard our radio, TV, and social media programs of all the activities planned for this week, not only as a ministry, but also through a joint intersectoral effort. I take this opportunity to express thanks to the hardworking healthcare workers throughout the region of the Americas, especially in my own country, Dominica, for their commitment and dedication. Today, more than ever, we recognize the value of the work that they have done, because our achievements would not have been possible without them. Your bravery and compassion, especially during medical emergencies and in times of crisis, is outstanding and commendable and deserving of our utmost gratitude and support. In closing, I am making a regional call to everyone in the Americas to come out as a family and get your vaccination shot, so that when you are asked the question, are you fully vaccinated, you can respond, yes, I got the shot. I thank you.
Thank you, Minister, for those inspiring words and setting the scene for what Dominica has been doing in this excellent work related to immunization. And I think every one of us will join you to say, when we're asked the question, the answer should be, yes, I've been vaccinated. I now have the honor and privilege of inviting my own director to the floor. After sorry, I apologize. I was going to miss the most important part of the technical part of the program. I apologize. I would like to invite Dr. Jabez Barbosa, PAHO's Assistant Director, to present an overview of the situation of the expanded program on immunization, the COVID-19 vaccination, and what Vaccination Week of the Americas has been doing to support these efforts. Please welcome Dr. Jabez Barbosa.
Thank you. Good morning. Honorable Reginald Ostry, Senior Minister and Minister for Housing and Urban Development and Acting Prime Minister. Honorable Evan McTighe, Minister for Health, Wellness and New Health Investment. Honorable members of the Cabinet, Your Excellency and members of the Diplomatic Corps, Dr. Carissa Etienne, Director of the Pan American Health Organization and Regional Director of the World Health Organization, Mrs. Leticia Lestrade-White, Permanent Secretary, Minister of Health, Wellness and New Health Investment, Dr. Mer Lewis, Chief of Staff, Pan American Health Organization, Dr. Godfrey Sherb, Head of Country and Sub-Regional Coordination, all the members of the PAHO team. I just want to recognize individually the two people from the immunization sector that are here, our Maria Ropero, who was present and was one of the organizers of the 5th regional week of vaccination, and the Dr. Andrés Francisco, who is the current acting chief of the immunization unit. Mr. Marlon Marie, UN Country Coordination Officer, members of staff of the Ministry of Health, Wellness and New Health Investment, all the distinguished guests, members of the media, ladies and gentlemen. It's my pleasure and a privilege to share with you a brief presentation about the vaccination week in the Americas. We have many important achievements during these years. PAHO has been a very important leading the world, leading the countries, supporting the countries, providing technical cooperation to the countries, and we have many achievements that are made in this region. The last case of smallpox, for instance, in Latin America and the Caribbean was in 1971. The Americas was the first region to be certificated as polio-free in 1994. We had in 2003 the first vaccination week in the Americas. We were the first region free of rubella in 2015. We were the first region free of measles in 2016. Unfortunately, now we are dealing with an outbreak of measles in my country, in my home country, Brazil, but very, very close to be fully controlled. So probably we will achieve again the regional certification, but all the other countries still remain totally free of measles. The problem is only some important cases that we have every year, so we need to be vigilant. And last year, we have this very important challenge that was to start the vaccination against the COVID-19. So this is, as the Honorable Minister said, this is a celebration, but it is always, I think, that a call for action. When we see the vaccination coverage in our region, this is polio as an example. It was decreasing. Since 2016, we have achieved an average of 87%, and it decreased to 82%. If we go to measles, the situation is very similar, and we have had some outbreaks in our region, as I mentioned. We had an outbreak in Venezuela, an outbreak in Brazil, an outbreak in the US. In Venezuela and in the US, they were fully controlled with the support of PAHO. Even in the difficult and challenging times that Venezuela is facing, we could vaccinate more than 80 million children and control the measles outbreak. And Brazil now is very close to control the outbreak again. Here we have a kind of a snapshot about the vaccination coverage. As I mentioned, we see that for most vaccines, the vaccination is decreasing for many reasons. And it is very important to call the attention because we need, at the political level, a very important commitment of the government. The problem with vaccination is that sometimes the success is the reason for the physicians, the new physicians, the new pediatric physicians, they haven't seen a measles or a polio cases for many years. So even the families and the community, sometimes they think that these diseases are totally over and we don't have any risk to have the vaccine preventable diseases coming back again. And this is not true. For this reason, we need to have this kind of high-level political commitment, the commitment also from the communities. We need the vaccination to be totally integrated in the primary health care. We need the vaccination programs using data to identify the barriers, why some groups are not getting vaccinated, why some families, what are the doubts, the questions that these families have in order to get their children vaccinated. So we need to use it to make a better use of the data that we have to identify these pockets that are not being reached and to implement some specific strategy to get these families, these communities being vaccinated. Here we have this very important negative impact that was the pandemic brought to us, and the minister has also mentioned this, and vaccination, immunization services were affected because some healthcare workers needed to be diverted to hospitals because during the peaks, people were not comfortable to go outside and to go to a health facility. So we need now to develop specific strategies to recover these people. Here we have now the vaccination, COVID-19 vaccination in the Americas. We have around the 1.79 billion people that vaccine doses, that were administered in the Americas. In the average, we have 67.2%, but this is the average. We have many disparities among the countries, and even within the countries, we have some population that we need to develop specific strategies to get them vaccinated. We still have 231 million people that haven't received one dose of the COVID-19 vaccines yet. So the pandemic is not over. The numbers are going better. Probably we are in a couple of weeks or months, we are probably leaving the acute phase if we don't have a new variant of concern. But we still need to close this gap. We still need to increase the vaccination in our region. In this next slide, you can see the difference that you have in our region. Some countries haven't yet reached the 40% that was the goal to be achieved in December. Last year, the more concerning situation that you have in our region is Haiti, because due to difficult situation in Haiti, the political crisis, economic crisis, we are still below 10% in Haiti. The coverage in Haiti is still below 10, so we are working very closely with the Ministry of Health or the partners in the country to strengthen the capacity of the country to deliver the vaccines, to increase the uptake of COVID-19 vaccines. Here we have the kind of a timeline of the vaccination week in the Americas. From the first one, and the focus was the measles outbreak that we had at that time. And every year we had many achievements, and the other regions started following the good example from the Americas. So we were the first region of WHO that implemented the vaccination week. But in 2005, Europe followed the Americas and established their vaccination week. Africa following 2011. And in the World Health Assembly, it was established as a global vaccination week. So every region can benefit of that. So in these 20 years, we have very impressive numbers. More than 1 billion people were vaccinated under the activities of the vaccination week. We have 6 vaccine preventable diseases that were eliminated in the Americas during these 20 years. So this is a very, very important initiative that was developed because it calls the attention, it mobilizes the communities, the political leaders, the technical workers in them. We have some very important results. In 12 countries, more than 200 million people last year were vaccinated during the vaccine, even during the pandemic, so it was a very important achievement. We have more than 56 million people vaccinated with influenza during the vaccination week last year. More than 137 million people received the COVID-19 vaccine, including the very vulnerable groups, older adults, persons with underlying conditions that benefit from this initiative. More than 2.7 million children and adults were vaccinated against measles to support the regional elimination goal. And also the social media campaign last year carried out in PAHO's regional council reached more than 92 million screens and generated more than 4 million engagements. This year, the goals are to build trust and confidence in the safety and effectiveness of all vaccines. We have seen in many countries in our region and in many Caribbean countries too, Prime Minister and Honorable Minister of Health, some families that have doubts, even healthcare workers that are not, they don't trust the vaccines. They trusted in the past because sometimes they think that the vaccine against COVID-19 are not fully tested to be sure that they are really safe vaccines. Some people think that they are still experimental vaccines. So we have developed a lot of efforts working with the Ministry of Health to build more trust and confidence in the vaccines. And this is the main purpose that we have in this vaccination week. We need to strengthen the scope and reach of the routine vaccination program during and after the COVID-19 pandemic. We need to recover, we need to identify children and families that haven't got all the vaccines last year. And we also need to accelerate COVID-19 vaccination operations in all countries and territories to achieve the 70% goal before June this year. So we have some targets that were developed for each country. In each country, the PAHO's country office working with the Ministry of Health are establishing the goals. In each country, they have some difference. Some countries are focused more on measles, others are in influenza vaccines, others to increase the COVID-19 vaccine. So we have activities in all countries in the region. Another very important topic, next slide please, is keeping the focus on equity. I think that we cannot forget that in our region, unfortunately, the Americas is one of the most inequitable regions in the world, and it's not only inequities between countries, but it's inequities within countries. So it's very important to call the attention for this very important topic, reaching the unreached. PAHO developed a lot of work with some Ministries of Health in Latin America to reach out indigenous groups, for instance, to reach out Afro-descendant population, migrants, and people that have difficult to access health services. It's very important also to call the attention for the need for a high-level political advocacy, to get again the president, the prime minister fully committed with vaccination, resource mobilization. We are in a permanent dialogue with donors and stakeholders to get more funds to strengthen the capacity of the countries, the cold chain capacity, to mobilize resources in order to increase the uptake, vaccination uptake in the countries. Communication strategies also, it's very important to take them look into the local and cultural context to promote inter-country coordination, especially in border areas, and increase vaccination coverage for all antigens across the life course with special focus on high-risk groups. We have a regional communication campaign, and this is part of the communication campaign for sure, because we are broadcasting this meeting for all the countries in the region. And we have developed regional posters, identity booklet, metro bus shelters in Washington, D.C., that is PAHO's headquarters, banners, the 20-year celebration video, direct messages, social media packaging and activities in order to be used all over the Americas to call the attention for the very important task that the communities, families, governments have to get their people vaccinated. Finally, I want to thank the partners that have been working with PAHO to organize this very important event. And again, it's a celebration, but it's also a call for action. And it's very important to be here. Dominica, congratulations, 92% of HPV coverage. I think that indeed is a very important coverage. And we want to thank you. It's very important to be here celebrating this event with you. Thank you.
Thank you, Dr. Barbosa. And it's a good thing I realized I had made a mistake in the program, because we should not have missed that important, informative presentation. And as you rightly said, the impact of Vaccination Week of the Americas has been far and wide, and the EPI programs have their work cut out to reach more and more people with benefits of immunization. Now, it is my great privilege and, and honor to invite the director of PAHO, Dr. Carissa Etienne, for her keynote speech. Madam Director, the floor is yours.
Thank you very much, Dr. Godfrey Shreb. And good morning to all of you here with us and all of those who are participating throughout the Americas. We are certainly, it's certainly a great pleasure to be joining you from the tiny island, but the beautiful island of Dominica. Honorable Reginald Ostry, Acting Prime Minister, Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Health Investment, Dominica. And let me greet all of the other ministers present here with us, but also the other ministers throughout the Americas who are joining us virtually. Let me also greet Excellency Gabriel Boric Font, the President of Chile, Your Excellency Xiomara Castro Sarmiento, the President of Honduras, Excellency Guillermo Lasso Mendoza, President of Ecuador, who will be joining us virtually. Let me also greet Dr. Rochelle Valinsky, the US CDC Director, Dr. Carla Barnett, Secretary General of the Caribbean Community, CARICOM, and all of our distinguished representatives from partner agencies, including our coordinator of the UN programs, UN coordination, and also our partners across the Organization of the American States, Centers for Disease Control and Prevention, UNICEF, the Spanish Agency for International Cooperation for Development. Let me also greet Dr. Peter Figueroa, the chair of PAHO's Technical Advisory Group on Immunization, who is with us virtually. Of course, my PAHO colleagues, Dr. Jambas Barbosa, our Assistant Director. We have 6 departmental directors with us here from Washington as well. Let me greet Dr. Merle Lewis and PAHO staff from Immunization Program and Health Systems. Specially invited guests. Let me greet all esteemed ladies and gentlemen, and importantly, all the healthcare workers across the Americas. Our sincere congratulations and thanks to you, our health workers. You are the heroes and have been the heroes for a long time, but you have been recognized over the last 2 years. Thank you. So let me say that today it gives me really immense pleasure to welcome all of you to the launch of the PAHO's 20th Vaccination Week in the Americas and the 11th World Immunization Vaccination Week. Before proceeding further, however, I would like to convey our sincerest gratitude to the Honorable Prime Minister and the government of Dominica for allowing us the privilege of hosting the 2022 regional launch of Vaccination Week in the Americas from the scenic and lush island of Dominica, the Nature Island. This observance of Vaccination Week in the Americas takes place within the wider celebration of our 120th anniversary, during which time PAHO has provided solid and uninterrupted technical cooperation to our member states of the Americas. The provision of technical cooperation in immunization has been underpinned by PAHO's 43-year-old revolving fund for access to vaccines. Dominica participates in this fund, and most of the countries in our region do participate. This revolving fund is an expression of Pan-American solidarity for public health, and it has given all member states access to quality and safe vaccines at a single price for any product, regardless of the country or territory's economic status. This extraordinary testament to regional solidarity and the power of regional pool procurement has been underpinned by evidence-based technical support and multilateral cooperation. The unwavering vision of member states of the Americas for the elimination of vaccine-preventable diseases, backed by sustained financial commitment to your national immunization programs, has stood the test of time. Our region leads the world in the successful eradication of smallpox, the elimination of poliomyelitis, measles, and rubella, and the early introduction of new vaccines, such as pneumococcal, human papillomavirus, rotavirus vaccines, among others. So today I wish to congratulate every PAHO member state on these pioneering and innovative public health achievements, which would not have been realized without the solidarity and the steadfast cooperation of you, our member states. And these are attributes which have proven to be notable strengths of the region over the last 120 years. However, we cannot and must not take our remarkable progress for granted. The inequitable access to COVID-19 vaccines and the widespread vaccine hesitancy have unmasked concerning fault lines along our regional landscape. The public discussion of COVID-19 vaccine hesitancy has also turned the spotlight on vaccines in general as never before. And I dare say that it is a dilemma that must be addressed sooner rather than later, so soonest. It has been 15 months since COVID-19 vaccines first became available. And we owe this monumental scientific breakthrough to the many researchers, scientists, regulators, and thousands of individuals across the globe who participated in the associated clinical trials. Their painstaking work and life-saving contributions made it possible for over 11 billion COVID-19 vaccines to have been administered worldwide, and for over 66% of people in Latin America and the Caribbean to have been fully vaccinated against the devastating virus. But this seminal achievement is, however, not sufficient. You heard from Dr. Jabas Barbosa, over 200 million people in our Americas have not received a single dose of COVID-19 vaccine. So there is still a long way to go to ensure that all populations at risk receive the doses that they need for protection. And this is especially critical for the elderly, people with chronic diseases, pregnant women, persons living in situation of vulnerability, and of course, the healthcare workers in each country. Distinguished ladies and gentlemen, governments, let us make no mistake about this. While we labored arduously to protect our populations against COVID-19, Our routine immunization programs were severely affected. You heard from the Minister of Health of Dominica. You heard from Assistant Director of PAHO, Dr. Jabas Barbosa. Our health systems were overwhelmed during COVID, and many health staff were redeployed to manage the national COVID-19 response, while overpowering fear of becoming infected deterred many individuals from attending vaccination clinics. But it is important to note that even before COVID-19 brought the world to a sudden halt, our coverage for routine vaccines had fallen below optimal levels. I want to just repeat this. Prior to COVID-19, our coverages for vaccination had dropped below optimal levels. And this must be a concern for every government, every healthcare worker, and every family in our region. The past 2 years have rolled back nearly 3 decades of progress on polio and measles vaccination and left us at risk of reintroduction. Today, we are again at the same vaccination coverage levels that we reported in 1994, when these diseases still posed a serious threat to our children, families, and communities. In 2020, 2.7 million children in our region missed the essential vaccines needed to keep them healthy and to support them in reaching their fullest potential. If this situation continues, we will pay an extremely high price in loss of life, increased disabilities, and economic and enormous financial costs. For example, if we had to collectively control and recover from an outbreak of polio, the impact would be devastating on individuals and member states alike. And it can last a long time because the disabilities that will be caused by polio will be present with us for many years to come. So I want to urge us all, I want to urge all governments, all healthcare workers to seize the momentum that has been generated by this high-level political interest in COVID-19 vaccination. Let us leverage this opportunity to rebuild our routine immunization services as a fundamental pillar of strong, resilient, equity-centered primary healthcare system that can provide essential services for the entire population. Vaccines save lives and will also contribute to the return to the full economic life for the countries of our region. As in previous observances of Vaccination Week in the Americas, let us focus all our efforts on reaching as many eligible persons as possible in our communities. And I know that in every country of the Americas, in this week, there will be tremendous outreach to reach individuals at the really the most remotest parts of our community, individuals from vulnerable populations, migrants, etc., to ensure that we raise vaccination coverage. Let us close the gaps in vaccination coverage for all antigens, including COVID-19 vaccines. Vaccination Week is also a unique opportunity to disseminate and publicize our messages to people about the life-saving importance of vaccinations and to generate spontaneous demand for vaccine. This is a chance to dispel doubts and promote the benefits of vaccination throughout the life course. Yes, this is a celebration, but we want to make sure that everyone is invited to this celebration. I wish gratefully to acknowledge the continued hard work and the unstinted dedication of the staff of the national immunization programs of the countries in our region. Not only during this last 24 months of the pandemic, but for their many years of diligent service before the pandemic. You have all worked long and stressful hours to ensure that the benefits of vaccination reach as many people as possible in your communities. Thank you for your persistent commitment and dedication to the health, protection, and well-being of the peoples of the Americas. You have contributed greatly to the sustainable development of your countries. This is the last occasion on which I will have the privilege as Director of PAHO to launch Vaccination Week in the Americas. No, we have to move on. I would like to remind everyone that we must never ever let our guard down on an essential public health service such as immunization. Vaccines present a highly cost-effective, safe, and efficacious intervention in our toolbox against vaccine-preventable diseases. Remember, PAHO was born out of the critical need for countries in the Americas to control the outbreaks of yellow fever. And our mission remains as relevant 120 years later. Finally, I humbly ask that you choose to implement equity-based solutions or options that are affordable and available to all, especially to low and middle income people, to regardless of their ability to pay, regardless of who they are, because national borders do not halt the transmission of communicable diseases. These solutions must be based on the principles of equity in access for all, leaving no one behind, and irrespective to social class, economic status, race, ethnicity, gender, orientation, or any such variable. Without equitable access to essential medicines, vaccines, and supplies, it will be impossible to safeguard the health and well-being of our communities. Member states of the Americas, the future health of this region in relation to vaccine preventable disease depends on your continued commitment, your solidarity, and the engagement to guarantee health for all. Open dialogue, trust, and outreach are the enabling tools on which we must rely to get more vaccines into arms and to ultimately save more lives. Today, we must all do our part to keep ourselves, our communities, and our countries safe and healthy. And vaccines are an integral part of this mission. So let me take this opportunity to ask every individual in the Americas, are you fully vaccinated? If not, please get all your shots. Thank you very much.
Thank you, Madam Director, and as usual, very inspiring words. You started as an assistant director with two main themes in your history: equity and primary healthcare. And I think today, as you said, this is the last Vaccination Week of the Americas that you will launch as director of PAHO. But still, in your speech, you continue to say equity and primary healthcare. And I liked your very much your message that everyone has to be invited to the celebration. So we will now have three messages from the presidents of Chile, Ecuador, and Honduras. We will start, and I invite the head table to maybe move a little bit so that they can view them on the monitor behind them. We will start with a message from the President of Chile, the Honorable Mr. Gabriel Boric, who will deliver the first message for this Vaccination Week launch. President Boric.
Quiero enviar un saludo y un abrazo a todos los trabajadores y trabajadoras de la
I'd like to send a greeting and a hug to all the workers of the Pan American Health Organization its director, and particular during this new vaccination week. There's no doubt that vaccines have had a tremendous importance in our recent history, and in particular in the last few years with regard to the pandemic, and in face of movements that sometimes question the effectiveness or the sense of these processes of mass vaccination. We can only defend what science has achieved, which through collaboration among scientists from all over the world, it has been developing mechanisms to combat such terrible situations as the pandemic. I think it is extremely important to point out that nevertheless, we are all in debt because the vaccination rates in the different countries of Latin America are still very different among countries. It does us no good for us to have high vaccination rates in one country when new variants of the virus are emerging in other countries, because all inhabitants of the countries have not been reached by the vaccines. Its organizations such as the Pan American Health Organization are tremendously important in this challenge. I would also take this opportunity to acknowledge the work of all of the healthcare workers who have been risking their lives for so long. They have put their own lives on the line to move forward with this unprecedented situation worldwide, at least for our generation, and their role has been invaluable. And so I thank you very much. During this vaccination week, I make a call that all of us complete our vaccination schedules. This has been a very beautiful experience of bringing our systems together to demonstrate that the public health systems play a key role in an integrated society. So thank you all very much.
Thank you, President Boric, for such a strong message in support of immunization and vaccinations. The second message you will be watching today is that of the President of Ecuador, Honorable Mr. Gabriel Lasso, and I invite you to...
Un cordial saludo para todos ustedes.
Warm greetings to all of you. After facing the COVID pandemic, the world has come to understand the importance of vaccines. Not only have vaccines saved lives, but they have been decisive in returning to normal life. That's why, as a country, we are celebrating the 20th edition of the Vaccination Week in the Americas by the Pan American Health Organization, which is being held from the 23rd to the 30th of April in a number of countries. In Ecuador, this week is part of the National Immunization Strategy carried out by the Ministry of Public Health, seeking to strengthen vaccination against influenza. Vaccination is our best ally to prevent and protect us from disease. We are proving that fact by bringing COVID down significantly with hospitals decongested and with ICU units also emptying out. This has only been made possible given our vaccination coverage against COVID, having immunized nearly 9 out of every 10 of our citizens. Now, it's good to know that during this week, we'll be going door to door with our vaccination brigades, also holding health fairs, open houses, inoculation stations, community radio broadcasting, and different strategic alliance undertakings to reach ever more people. We seek to reach 314,000 Ecuadorians. Of course, we can do it. We've already shown as much with the COVID vaccine. This week is also very important because given the pandemic, we have seen a shortage of vaccines for other diseases such as influenza, which affects millions of people, but this is no longer a problem. I congratulate the Health Ministry, which has undertaken the purchase of 14 million vaccines and bolstering the cold chain to keep them in good shape, good conditions. Now, in this conservation process, the government is investing $8 million, and this year, 14 million more vaccines are going to arrive, including vaccines for influenza. We are all going to get, or let's all get vaccinated, because vaccination is synonymous to health. Over these last 2 years, we have learned many things, among which the importance of vaccines. The pandemic has shown us that we are a fragile species. Let's not let backsliding jeopardize our health and that of our loved ones. A warm welcome, greeting to all of you, and may God bless you. Thank you.
Thank you, Mr. President, for your commitment and that of Ecuador's to supporting immunization. Your message really reflects the political commitment of your country to maintaining immunization as a public health priority. The third message we have from the head of state is that of the President of Honduras, Her Excellency Xiomena Castro. So I invite you to watch the message from the President of Honduras.
Good morning. I extend my most sincere greetings to the esteemed Dr. Carissa Tien, Madam Director of the Pan American Health Organization, and the Regional Director of the World Health Organization. Your Excellencies, Presidents of sister countries of the Americas, peoples of the great homeland, and especially of my beloved Honduras. I would like to express my appreciation to all of the health sector workers who, with great effort and commitment, managed to overcome one of the deadliest pandemics in world history. In order to protect ourselves and to ensure access to public health services for our population, especially against COVID-19, it's important for us to be organized. That's why, in my capacity as the first woman president of Honduras, I'm pleased to be here on the 20th Vaccination Week of the Americas and the 11th World Immunization Week. I would also like to congratulate the Pan American Health Organization for achieving 120 years of work together with member states and other partners, and for promoting health equity and its actions to combat diseases and improve the quality of life of the peoples of the Americas. I'm aware that during the pandemic crises, regular vaccination coverage has declined, and therefore I extend a powerful call to strengthen the national immunization programs and to invest responsibly in whatever is necessary to ensure quality, free and universal health care in our territories, especially for the most vulnerable sectors. I reiterate my commitment to the founding of Honduras. Honduras was left prostrated by the plundering and corruption and drug trafficking. We need the unconditional support of all healthcare workers in our land, and that's why I also make a call to civil society, to international donors, families, communities, and every citizen. I call upon you to join enthusiastically and with commitment to the Vaccination Week of the Americas and our great National Day of Vaccination and Deworming to reach those people who require the regular schedule of vaccination and that vaccination against COVID-19. On this day, let's take another step toward the refounding of Honduras by dismantling the narco dictatorship, which has oppressed us for 12 years. I join the call by PAHO and WHO to commit all of our efforts to make this possible, to ensure the vaccinations reach all corners of our country without overlooking the most vulnerable, no discrimination against anyone.
Thank you, Madam President, for those inspiring words and the support of your government to the Vaccination Week of the Americas. You've heard about the 20 years of Vaccination Week of the Americas. So we have now a brief regional video highlighting the 20 years of this important initiative, the effort countries have made to reach their population with life-saving vaccines under the umbrella of Vaccination Week of the Americas. Please enjoy this brief video, which shows us the extent of the work that has been done over these 20 years.
Vaccination Week in the Americas has been celebrated for 20 years. It's an annual celebration that aims to promote equity and access to vaccination for all people, no matter where they live or their socioeconomic situation. Everybody has the right to health, to vaccines, and to a healthier life.
Porque las vacunas salvan vidas. Aunque estemos en COVID,
Vaccines save lives. Even though we're in the midst of COVID, vaccination continues. We are talking about working 1 week to attain our different countries and different efforts led by different countries. We have about 15 million people still need vaccination. The challenge is huge. We want to make sure that the children in our country do not die from COVID. The means to reach users and their homes is important. Today, we are learning about the vaccine. For the sake of our family, it is very important to take these vaccines to all of those who need to get vaccinated. We need to be ready. Each one of us can do something. We must do our part. Well, I do my job with a lot of love and commitment. I feel extremely honored. And for me, it is an honor to work because this is a program that has very good results. Let us get vaccinated. Every day, we're fighting for the sake of all, for the Americas and for the entire world. Vaccines are extremely safe and effective. This initiative has been a magnificent example of what can be accomplished. When everybody can work together, we will have a healthy population, a prosperous country, because vaccination in the Americas demonstrates the political commitment of the countries.
In the past 20 years, more than 1 billion people have been vaccinated during Vaccination Week in the Americas, and different diseases have been eradicated in our region. Thanks to health workers, people in every corner get vaccinated. Today, we celebrate 20 years of Vaccination Week in the Americas. Are you fully vaccinated? Get all your shots.
I hope you've witnessed the wonderful work that has been done in the region, but as speeches have been said before today, there is always much more to be done. As part of our agenda today, we're also would like to welcome a message from Dr. Rochelle Valinsky, the director of the Center for Disease Control and Prevention of the United States of the Americas, who has been an important partner for the region of the Americas, both for Vaccination Week, for our vaccination program, but especially during this pandemic, with the United States having donated the largest number of COVID-19 vaccines. So I invite you to listen to the message that Dr. Valinsky has to give us on this important day.
It is my honor to join you for this celebration of Vaccination Week in the Americas. Please accept my personal thanks and my thanks on behalf of my colleagues at the United States Department of Health and Human Services for the work you do to protect the lives of millions of people throughout the Americas. With the arrival of safe, effective COVID vaccines in December 2020, the world's focus turned to the crucial goal of vaccinating 70% of the world against COVID-19 by the end of 2022, with an emphasis on those most vulnerable. The decades of effort put into building immunization programs around the world, done in partnership with the country's public health programs, helped lay the foundation for our ability to vaccinate the world against COVID. Capitalizing on the work put in place to rapidly scale up vaccination support for COVID-19 will provide many future dividends as we vaccinate against other diseases. It's CDC's longstanding commitment to reducing the burden of preventable childhood diseases and its investments in strengthening global health security that have helped countries build immunization and surveillance systems to prevent, detect, and respond to vaccine-preventable and emerging disease threats such as influenza, yellow fever, polio, and now COVID-19. We know that no community, district, or province within any nation will be truly safe from health threats until all are. We also know that no nation can truly be safe until all nations have the core public health capabilities and the health systems in place to protect the most vulnerable in our societies. We will only achieve our goals by working together. You have the United States government as your partners in this work. Thank you for your commitment to building a healthier future for the world. It is my honor to join you.
A very important message from Dr. Valinsky. Thank you for the support and your participation. As PAHO, we would like to also recognize the efforts and collaboration throughout the years of many of our partners. And as such, I am pleased that we are joined with Her Excellency Dr. Carla Barnett, Secretary General of the Caribbean Community, CARICOM, for a message on Vaccination Week of the Americas. Please join me in watching the message from Dr. Barnett.
Are you fully vaccinated? The COVID-19 pandemic has brought into sharp focus the importance of vaccination in saving lives. In this 19th celebration of Vaccination Week in the Americas, we need more than ever to promote vaccination, not only to protect ourselves against COVID-19, but also to ensure that the successes we have achieved in preventing or eradicating some highly contagious diseases among children are not rolled back. Vaccination has allowed the Caribbean to eliminate measles, smallpox, poliomyelitis, and rubella and congenital rubella syndrome. Unfortunately, according to PAHO, there is a less than average uptake of COVID-19 vaccines, as well as an observable change in the trajectory of childhood immunizations. There is a decline in vaccine coverage in almost every member state for MMR1 and MMR2 from 2020 to 2021. This is a matter of concern as our member states have traditionally achieved more than 95% coverage, a globally acknowledged success of the region. Shifting of human and financial resources towards responding to the COVID-19 pandemic has been identified as cause for the decline. But another factor, that of vaccine hesitancy, has contributed not only to very low COVID-19 vaccine uptake, but it has also negatively impacted immunization levels among our children. There are still too many of our children who are at risk of contracting vaccine preventable diseases. The reintroduction of any of these diseases would pose a real threat to losing the gains made in savings in healthcare costs, productivity, and the overall quality of life. In order to address the issue of vaccine hesitancy, the CARICOM Secretariat is collaborating with CARPA, PAHO, civil society, and others to redouble and accelerate public information and education efforts to address misinformation, myths, and other drivers or enablers of vaccine hesitancy. During this Vaccination Week of the Americas, I wish to lend my voice and my endorsement of the actions being undertaken by the Ministries of Health in CARICOM, by CARPA, and by PAHO to raise awareness of vaccines as a public health good. As we launch this Vaccination Week, let us strive to build on our successes, fully aware that the advancement and progress made over the years are under severe threat from the impact of COVID-19 on our health systems and our economies. There is still much to be done, and you and I have a role to play in ensuring that we are all safe by making sure that we are fully vaccinated. I am fully vaccinated. Are you?
Thank you so much, Dr. Barnett, for that very pertinent and inspiring message. CARICOM has always been an important partner for PAHO in the Caribbean for many years. As this launch is being held in the beautiful island of Dominica, which has a long history, as you've heard, of high vaccination rates, I would like to now invite His Excellency, the Honorable Reginald Ostry, Senior Minister and Minister for Housing and Urban Development, and Acting Prime Minister of the Commonwealth of Dominica, to share his closing remarks of this event and to inspire us to continue working towards fairer and healthier societies. Your Excellency.
Thank you, Mr. Chairman. Honorable Dr. Irving McIntyre, Minister for Health, Wellness, and New Health Investments, Dr. Carissa Etienne, Director of PAHO, and the Regional Director of the World Health Organization, Mr. Barbosa, Assistant Director of PAHO, Dr. Mary Louise, Chief Staff of PAHO, Dr. Godfrey, Head of the Country and Sub-Regional Coordination, other members of the PAHO team, Mr. Marlon Marie, UN Country Coordination Officer, members of staff of the Ministry of Health, my other cabinet colleagues, other distinguished guests, members of the media, ladies and gentlemen. Let me begin by extending to you the apologies from the Honorable Prime Minister, who is out on official business. It's interesting that he's out on this very important occasion on an official visit to Cuba, one of our collaborators in the health sector who have done tremendous work in our island. And we want to thank the Cuban government and people for the tremendous support given to us over the years. I want to express thanks also to Dr. Etienne, Carissa Etienne, and the distinguished team of health professionals from PAHO for selecting Dominica as the host for this auspicious occasion. It is indeed a pleasure to have Dr. Etienne, a proud daughter of the soil, here with us in her homeland. Dr. Etienne continues to distinguish herself as a professional of the highest standard, who serves as an example that excellence can come from small islands and can perform with merit on the world stage. We commend her for her leadership at the regional level as we took on the COVID-19 pandemic, and thank her for facilitating and supporting Dominica in our efforts to successfully manage the virus. And permit me, I know that I have only 5 minutes. So what I did, and I won't bore you, so what I did was to reduce the time spent for the occasion and to spend a little time with Dr. Etienne. After serving 20 years with PAHO and over 10 years as a director, there are many people who still don't know who Dr. Etienne is. And you'd be surprised that maybe even here in our own country, there are many people not only don't know, but don't recognize the work that Dr. Etienne has done in the health sector throughout the region and throughout the world by extension. When the government of Dominica placed our full support clearly behind Dr. Etienne's candidacy for the position of Director of PAHO, we did so fully confident of her exceptional capacity as a public health manager. Dr. Etienne began her career as a medical officer at the Princess Margaret Hospital, now the Dominica China Friendship Hospital, and was later appointed as Dominica's chief medical officer. Indeed, she can be credited as one of the architects of Dominica's primary healthcare systems. During her tenure as director of the primary healthcare services, Dr. Etienne improved the standard of treatment and preventative care provided at our health facilities and strengthened Dominica's primary healthcare system into a model of efficiency for the region and the world. Before moving on to serve outside of Dominica, she was a coordinator of the National AIDS Program, disaster coordinator for the Ministry of Health, and chair of the National Advisory Council for HIV/AIDS. Her proud standing as an effective and capable administrator at the local level certainly put her in good stead to provide the dynamic and strategic leadership needed to address the health issues we face as a region. As PAHO head, Dr. Etienne led the region through the Zika and chikungunya epidemics. And during her tenure, the endemic transmission of measles, rubella, and congenital rubella in the Americas was eliminated. Just last year, with the advice and guidance from PAHO, Dominica became one of the 7 countries in the region to achieve dual elimination of mother-to-child transmission of HIV and congenital syphilis. Dr. Etienne has also focused on the prevention of chronic non-communicable diseases, which I must tell you is also a priority issue for the Prime Minister and the Cabinet of Dominica, who continue to make a case for healthier habits among our citizens to reduce the high incidence of CNCDs here in Dominica. Dr. Etienne's most striking achievement, though it is unfolding as we speak, as a region of which we can be proud, the direction she has provided in our fight against COVID-19 virus. From the onset, the Pan-American Health Organization has been consistent and effective in the dispensation of resources and strategic direction to guide our country through the unknown of this life-threatening disease. We extend profound gratitude to Dr. Etienne for stewardship during this period. I wish to take this opportunity to commend her for the work which she has done and continues to do to transform and strengthen the national health systems, to reduce inequality, increase access to secure universal health coverage for all citizens. We also appreciate her success is heavily dependent on the strength of the PAHO team. Several of you here today, not only to mark the start of Vaccination Week, but also to assist us in strengthening our health systems. I thank you for your support and wish to extend a special welcome to you. The support from PAHO during the past 2 years and before has been invaluable, and I am sure many here today can testify of the guidance and advice and assistance which have been provided in the advance of our work here in Dominica. Now to regular programming. Dominica remains proud of our success in managing COVID-19 and limiting the number of fatalities associated with the virus. Of course, one death is one too many, but our health professionals have worked tirelessly in the past 2 years to keep our population safe and minimize the severe effect of the virus and related hospitalization. As of April 1st, we have been able to lift many of the more stringent restrictions associated with the movement of people because of the competence of our various groups of first responders and health workers who have given the highest level of dedication to the fight. Our hope is that we will continue to act responsibly as a people, adhering to the basic safety protocols to keep our COVID-19 numbers trending downwards. The government of Dominica recognizes, however, the need to increase our vaccination numbers. The theme for this week's observance, "Are you fully vaccinated? Get all your shots," applies to vaccination in general, but it is certainly a most timely and fitting admonition during this pandemic. As per the latest figures, Dominica has vaccinated 41.9% of the population, or just over 30,000 people. While we commend the efforts of the vaccination team to push the vaccines and to ensure availability of every single Dominican, we acknowledge that more of our people should have already received their shots. Dominica, after all, was one of the first countries in our region to receive a significant number of doses of vaccines. First, the AstraZeneca from India and Pfizer vaccine from the United States government. In April 2021, Dominica also received 28,800 doses of COVID-19 vaccines through the COVAX facility, a global effort involving PAHO and other international organizations. Vaccines have from very early been available to every eligible Dominican. And last year, all children over 12 became eligible for the shot. Due to the efforts of the Honorable Prime Minister and the government, access to vaccines, therefore, has never been a problem during this pandemic. Vaccine hesitancy, though, may remain a sore point. And despite our successes in containing the spread of the virus, we recommit to increasing our vaccination numbers this week and in the coming weeks and months. The excellent work done by the vaccination unit, led by Dr. Kimian Burnett, will continue with renewed commitment and targeted interventions to reach more of our citizens. We remind our citizens that in order to eliminate the threat of the resurgence of serious illnesses, hospitalization, and death, we must get vaccinated. Getting vaccinated against COVID-19 can significantly lower our risk of getting and spreading the virus that causes COVID-19. We cannot ignore this vital medical fact, even as we celebrate our gains. On a more general level, we note the Ministry of Health's success over many years to get our children vaccinated. The messaging that vaccines are the most effective way to prevent infectious diseases and protect our children from serious and potential deadly disease has reached the general population. And I commend our people for continuing to trust the science. This assures us of a healthier population, better equipped for the future. The Ministry of Health is also making efforts to increase our efficiency through the Electronic Immunization Registry, the EIR, which was commissioned for Dominica by the EPI unit of the Ministry of Health and Wellness and New Health Investments, and is funded by the Pan American Health Organization. It is an online tool which is expected to enhance the performance, coverage, and efficiency of the EPI. The project aims to create an immunization information system which encompasses all areas of vaccination management to improve immunization rates, productivity, and efficiency. We welcome this initiative and look forward to the results, the promotion of evidence-based decision-making, and more reliable data collection and management. Dominica, therefore, is on the line with its efforts in the regional and international level to strengthen our vaccination systems, increase access to life-saving vaccines, and ensure that higher percentages of our population are educated on the benefits of immunization. We stand in solidarity with PAHO's goal to accelerate vaccinations against COVID-19 and close coverage gaps against other vaccine-penetrable diseases. Once again, I encourage every Dominican, not yet immunized against this deadly virus, to take responsibility for your health and for the well-being of your families and communities. Get vaccinated and help secure the collective health and wellness of our country. We pledge our support to PAHO team on island as they go about their planned activities to help us boost our health systems and provide more effective healthcare delivery to our citizens. Dr. Etienne, we'll continue to be grateful to you as a son and a daughter of the soil, and that will continue to be of tremendous assistance and support to this country, even if after you have completed your stint with PAHO. I'm sure the Dominican people will find a suitable place where you can continue to make this country proud, locally, regionally, and internationally. Thank you once again for being here during this important week of activities and for your partnership with the government and people of Dominica. I wish you every success over the next days as you observe Vaccination Week of the Americas. Thank you.
Thank you so much, Honorable Minister, for your moving words, the commitment of your government, and the kind words about the daughter of your soil and the director of PAHO. I thank everyone who have sent messages today or have presented today, and we're coming to the end of our celebration event for today. But before we close, I want to thank, on behalf of the director and the head table, the communications team of PAHO, and the national team, who have worked so hard to ensure that everyone who is connected through Zoom or watching the broadcast on YouTube were able to join us in this new hybrid celebration where we have virtuality and real life mixed together. We truly appreciate your work. I also want to say a big thank you to all those who are committed to immunization programs around the region. Thank you from the bottom of our hearts. Before we close, I would like to ask the three persons on the head table to move to the other side of the room. Whereas it's traditional on an anniversary or a birthday, we have a cake to commemorate the 20th birthday of the Vaccination Week of the Americas. Honorable Ministers and Madam Director, I invite you to cut the cake on behalf of all the citizens of the Americas who have benefited from the vaccination programs throughout these 20 years. But as you cut the cake, we hope that there will be many more millions who benefit from the vaccination programs of the Americas over the coming years. Thank you. Happy birthday to Vaccination Week of the Americas. And before you leave, there are some birthday gifts which you can all take, as well as part of the birthday cake. Thank you, everyone. Looks like a beautiful cake as well. This is PAHO sharing with the member states. Please help yourselves also to the little cakes so that everybody can share with the part of the cake. And as I said, please take, as you're leaving, the birthday present that we prepared for all of you. Thank you, everyone. And thank you all of those who are on Zoom and on YouTube for this event. This comes to the closure of the event. Thank you, everyone.